Here with me again, Dr. Raul Marquez. Hello,
Hi,
Dr.
Joanne.
Marquez.
And hi, everybody. Thank you for joining us today.
Our goal during this program is to provide valuable healthcare information that will help you and your family maintain an active life.
At this point, we are now inserting the real prosthesis. We put it in the bone. In her case, we are using a prosthesis called a press-fit prosthesis. Press-fit, we don't use any glue or cement. We are simply impacting that prosthesis, so because the measurement has to be so precise, so the bone will grow around the prosthesis and will fix it to itself. It's more a biological fixation here. Usually the patients have less pain. We don't have to use a lot of foreign material like the bone, the cement that we're using. We are placing the femoral component, or the last component of the surgery. You can see that shiny structure is called the femoral component or the thigh bone. We are impacting it, pressing it in the bone itself, and again, it doesn't have any glue. We already have checked many times that is exactly how we like to end up the surgery. And you can see for this type of prosthesis, you know, or this type of operation, the incision is fairly small. We remove everything, and then now we're going to recheck.
The idea that exercise makes arthritis worse is a myth. In fact, the opposite is true. Exercise stimulates the cartilage and absorbs nutrients and repairs itself. Choose the right low-impact exercises like walking and swimming and make them your daily routine.
John, 64, 25 years electrical engineer, father to Richard, Mary, and Sam. Knee replacement surgery, April 2004. Jean, 62, 30 years teacher. Mother to Mary and James. Knee replacement surgery, February 2003. Don't let an injury slow you down. Call Dr. Raul Marquez today and get back to life.
Now, does the patient return to a normal life 100%?
Well, it depends on what you call normal life and 100%, because as good as a surgeon I am, I don't think it's a better knee than the one that God gave us, first of all. It is an artificial joint. The purpose of the surgery is to return into an active life, to have much less pain. And I need to emphasize again that this type of surgeries are very predictable. We can almost assure the patient that the pain is going to improve considerably. So yes, they can go back to regular activities. In regular activities, I'm talking about regular walking. We don't expect them to do contact sports by any means, and this surgery is obviously designed for patients, for older patients where the level of activity is less. But yes, I can tell the patients that they will most probably will feel much better, have almost no pain, and so they can participate in what they wanted to do before, like golfing or walking, swimming.
Now, how long is the process of therapy, and can a patient do a therapy at home?
Well, the process, as we mentioned before, is about 6 weeks. Yes, the patients can do the therapy at home, and that is basically based on patient preference, and also there's a lot of factors why the patient will benefit from home therapy. Sometimes they have more problem than just the arthritis on the knee. They have a lot of multiple medical problems, and they are very well taken care of as a home therapy. That is one of the options that we have available for our patients.
Now that the procedure is done, the patient stays in the hospital for some time in the recovery stage. What does the recovery entail? What does the patient have to go through after surgery?
Well, right after surgery, usually surgery, as we mentioned before, takes about 45 minutes, an hour. Then it goes to the recovery room. but the average patient stays in the hospital about 2.5 days. The patient will have the choice then to go to what we call a rehabilitation hospital or an in-hospital type of physical therapy. Also, a good option is home health or home health therapy, where the patients can recuperate at home. The other option is that the patients come to the office and have outpatient type of physical therapy. The average time of the physical therapy is about 4 weeks, 4 to 6 weeks. The patients walk the day after the surgery, walk with a walker, and then after they go to a cane and they graduate with no cane. And everybody's different, but the average patient usually can ambulate, can walk without any help in approximately 3 to 6 weeks, depending on the patient, depending on the age of the patient as well. But most of the time, I think we are reducing the time for recovery for the patients with this type of operation.
It's very important for the patient to immediately start exercising. That's why the therapy takes in. Why is that so important?
Well, it is very important. We know for many years of experience that, first of all, the faster the patient moves, the less pain is going to have, the less stiffness is going to have, the faster it's going to recuperate, there's going to be less swelling, and that's why we emphasize to all my patients that, first of all, right after the surgery, we put them in a machine that is called the CPM. CPM stands for continuous passive motion. That means the knee is moving while the patient is resting, and that allows for increased circulation, allows for decreasing the swelling, but also emphasize a lot the physical therapy where the patient start ambulating, start doing this own exercise, and there's a lot of teaching that gets involved into this type of recuperation. You know, it is a lot of interaction with the patient. It's a lot of fun. I think the therapist has to do a lot with this type of recuperations. I always tell my patients it's a 50-50. 50% is what I do. I need to do a good surgery, but also the patient needs to put his part. And the more the patient is involved, the more they participate on this type of surgeries, the better they're going to be. Why? Because they're going to have less pain. They're going to be more receptive to my suggestions, so they can go back and continue their active life.
Now, Dr. Marquez, how is this patient doing, the one we just saw?
Well, this particular patient, I'm happy to report that she is doing very well. She is doing as we told her, as we expect. She walked the day after the surgery. She walking with a walker, and then is graduating to a cane right now. And so hopefully she can go without any help after that. The pain has decreased considerably. She is now taking just pills for control of the discomfort and the pain. So far, so good. It is very rewarding for us to be able to educate the community and answer any questions you may have. I would like to remind you that all the topics discussed in this show are for educational purpose only. Every case, every individual is different. If you have any questions, please contact your doctor or call us at the office.
Once again, we'd like to thank Affectionate Home Care for helping make this program possible. Thank you for being with us today, and we'll see you here next week.
Thank you.